This is Rachel. She suffers from shoulder pain and trigger points of the thoracic spine and cervical spine. Today I evaluated her and performed trigger point injections. I just wanted to go over her anatomy. What we're looking at here is the supraspinatus muscle under the deltoid, the two muscle layers. You can also do a 90-degree turn and visualize this in the short axis. And as we go more distal, I run out of space to image because we have the acromion up top, that bone, and the spine of the scapula protruding, so it's a more narrow space. So I have to go 90 degrees to visualize the region. And of course, our friend, the suprascapular nerve block, comes into play at the bottom right aspect of the screen, under the transverse scapular ligament. Scanning inferior to the spine of the scapula, we could see the actual infraspinatus muscle tapering as we go laterally to the humerus where the tendon inserts, right here, and you also have the glenohumeral joint. When I scan the humerus, the bone itself, I could see the deltoid muscle as well as the head of the humerus and the shaft. I see the hyperlucency next to the shaft, and that's actually the axillary nerve inserting. And this is a target for peripheral neuromodulation for chronic shoulder pain. Sometimes if we go medially, we could actually see the blood vessels that run with the nerve, the circumflex vessels. Color mode. Okay, and we see blood vessels here. As we go more laterally, they're a little tortuous, so they're not going to look completely circular or linear. And the nerves run with the blood vessels, and here they are. The hyperlucency around the blood vessel is the axillary nerve, and this would be a target. It typically will run between teres minor and major as they go laterally towards the humerus under the deltoid. And if I was to do a nerve block here, I would come in plane and go longitudinally above my probe. First I would do a diagnostic, and then I would do peripheral nerve stimulation. Body of the teres minor muscle over here, and that's the shoulder. Thank you.